Good evening, sir. My topic is about documentation, audit, and feedback in anesthesia. Documentation in anesthesia definition: systematic recording of all relevant anesthetic and perioperative information in a patient's medical record. The importance is it is very useful in legal and medico-legal purposes, communication among healthcare providers, clinical auditing and research, continuity of care, and defense in case of litigations. The pre-anesthetic evaluation, which includes patient's name, procedure, identification, medical history, which includes patient's ability to give informed consent, surgical history, anesthetic history, current medication list, which includes pre-admission and post-admission, allergies, adverse drug reaction, including reaction type, NPO status, and documenting the perioperative plan. Other things include appropriate physical examination, including vital signs, height, weight, documentation of airway assessment and cardiopulmonary examination, review of objective diagnostic data, which includes labs, ECG, X-ray, and other medical records, medical consultations when applicable, assignments of ASA physical status, including emergency status, the anesthetic plan, including plans for post-anesthesia care and pain management, documentation of informed consent, which includes risk, benefits, and alternatives of the anesthetic plan and post-operative pain management plan. Intraoperative or procedural anesthesia. Immediately prior to the start of anesthesia care and anesthesia procedures, the patient is to be re-evaluated. Confirmation of availability of appropriate function of all necessary equipments, medications, and staff. Physiological monitoring data, which includes recording of results from routine and non-routine monitoring devices, medications administered, which includes dose, time, route, responses wherever appropriate, anesthetic techniques used, patient positioning and actions to reduce the chance of adverse patient effects, complications related to positioning. If additional procedures performed, vessel location, catheter type, size, specific insertion technique, actions to reduce the chance of complications, etc., to be included. Unusual or noteworthy events during surgery and anesthesia care. Documentation of fluid or product administration, output types and amounts to be included. Patient status at the transfer of care to staff in post-anesthetic care unit or an area which provides equivalent post-anesthesia care. Post-anesthesia documentation, which includes a time-based record of events that reflect the patient's status on admission and discharge from the post-anesthesia care unit. Discharge from the post-anesthesia care unit is determined by a qualified anesthesia professional or by a local department discharge protocols. If the PACU is bypassed, the criteria demonstrating the patient's status at transfer of care are appropriate. Significant or unexpected post-procedural events or complications to be noted. Coming to the audit definition, it's a systematic process of reviewing anesthesia practices against defined standards to identify areas for improvement and enhance patient care. It involves evaluating the quality of anesthesia services, identifying potential problems, and implementing changes to optimize patient outcomes. Audits are crucial for ensuring patient safety, promoting clinical effectiveness, and fulfilling professional responsibilities. The key aspects of anesthesia audits includes the purpose. The primary goal is to improve patient care and outcomes by systematically evaluating current practices, identifying deficiency, and implementing changes. It has to be a systematic review, which includes a structured approach to collecting and analyzing data related to various aspects of anesthesia delivery. Comparison to standards, performance is measured against predetermined criteria, guidelines, or best practices. These standards can be national, international, or institution specific. Implementation of change. The audit cycle isn't complete until identified problems are addressed and improvements are implemented. Re-audit to ensure the effectiveness of changes. Audits are often cyclical, with re-audits conducted to assess the impact of interventions. Benefits of anesthesia audits includes improved patient safety, enhanced quality of care, standardization of practice, identification of training needs, Like it highlights the areas where staff require further training or education. Medical legal protections like thorough documentation and adherence to standards demonstrated through audits can be crucial in medical legal cases. Resource optimization, it can identify inefficiencies and help to optimize the use of resources. Professional development, participation in audits fosters a culture of self-reflection and continuous learning among anesthetists. Audits provide a mechanism of demonstrating accountability for the quality of care provided. The audit circle includes choosing a topic, setting standards, collecting data, compare with the predetermined standards, implementing changes, and doing re-audits. There are national audit projects which are internationally important reports with a potentially significant impact on patient outcomes and experience during and after anesthesia and surgery. There are approximately 8 national audit projects. The 8th one is in the planning stage. Coming to the documentation. So coming to the feedback in anesthesia. Feedback is defined as a structured process of providing information regarding performance for the purpose of improvement. It's a crucial for learning and professional development. It includes providing constructive information about performance to guide improvement, moving beyond simple evaluation to a collaborative conversation. Key aspects of feedbacks in anesthesia includes either formative or summative. Feedback is generally formative, meaning it's used to improve performance on an ongoing basis, while evaluation is summative, assessing overall performance at the end of a period. Constructive and actionable, which includes it's a high quality feedback, is specific, balanced, and provides clear guidance for improvement. It should focus both on strength as well as areas for development. It's a learner centered. Understanding the learner's perspective, their prior knowledge, and their thought process is crucial for effective feedback. Timing and delivery, which includes the feedback should be timely, ideally delivered soon after the observed performance, and delivered in a way that is conducive to learning, such as face to face or through structured observation. Effective feedback requires strong supervisory skills to create a safe and supportive environment for learning. Feedback in anesthesia is a critical component of experiential learning, requiring a shift from simple evaluation to collaborative, formative, and actionable approach that supports the development of competent and confident anesthesia professionals. Thank you, sir.
Good. So this is a question which was asked in the last paper, and who was the first person to demonstrate the importance of documentation? How did he do that?
Florence Nightingale. In the World War, she demonstrated the sterile practice. Documentation or audit, I think, sir. Florence Nightingale.
Audit.
Yes, sir.
Asking about documentation. Was it done by an anesthetist or surgeon? Make a guess.
Anesthetist.
Anesthesia was a later specialty. Earlier, it was surgeon who himself administered anesthesia, operated, and all the things. So anesthesia became a separate specialty very lately. So that is why still the dominance of a surgeon is there. Okay. So the first recorded documentation of intraoperative events was done by Dr. Harvey Cushing. You heard of that name?
No, sir. Cushing.
Cushing syndrome.
Cushing syndrome.
He was the one. So which specialty you think he should have been? Yeah. He was a neurosurgeon. Okay. Harvey Cushing was a neurosurgeon. He asked a nurse to monitor the pulse, BP, and color of the blood of the nails every 5 minutes by a nurse when he was operating. It was the first known method of intraoperative documentation of vital functions. Then gradually it spread to the preoperative evaluation, optimization, risk stratification, intraoperative management, post-op management. So like that, it was classified into all the segments of perioperative management, and all the things were documented. What was the method of documentation in the early stages?
It's manual, sir.
Manual.
Paperwork.
Even today, do you have your anesthesia chart which you fill in the during surgery and send it to the post-op ward? Yes. So you have the graphical paper is there. Where you mark the systolic BP, diastolic BP, pulse rate every 5 minutes or 10 minutes, 15 minutes, depending upon the nature of the surgery, and also incidents like induction, intubation, the incision time, preoperative, any hypertension, and then the fluid you start with, and then till what time it was flowing, when did you change it to the next fluid. All that is jotted down in the anesthesia chart or record. And this is, you are doing it manually. But nowadays, what is the reason that it is made automatic by machine to be recorded? What is the reason for changing from manual to automatic recording?
To store more data. So.
Right. One thing is manual, you are always likely to become a part, especially when you do a long case. You may miss out 1 or 2 readings. Then try to cook it up and fill it up in between. Whereas if it is made automatic, everything will be recorded. Okay. So there will not be any missed data, and it takes away the strain of the anesthetist in writing the chart and also concentrating on the patient's condition and trying to observe what changes are taking place. So they have changed it from manual recording to electronic or automated recording system nowadays. And when it is automatically or electronically recorded, is there a different name for this documentation, audit, and feedback? What is AIMS? Don't tell me it is the Delhi College of Medicine. What is the expansion for AIMS? AIMS. Kamal and Damodaran.
Automated information management system, sir.
Anesthesia information management system, not automated. So your guess was almost all right, except for the first letter. Okay. It is anesthesia information management system. That is where you electronically record all the data, both intraoperatively, preoperatively, postoperatively, and then analyze those data for doing your audit, and based on that you can do all the feedback or corrective measures if you have gone wrong. Okay. So the same question can be asked as AIMS also in the paper. So both of them mean the same thing, and whatever points Dr. Bindu has described, she has described very well. So the notes can be taken as answer for this, but it is little too elaborate. You can make it a little more concise, because you have to answer these questions within 20 minutes time in your theory paper. So right from this stage, you have to learn how to make it concise and finish the